You mentioned that you're trying to have a baby, but you've had very irregular periods and some recent bouts of spotting, and you've taken some home pregnancy tests, which have been negative. But the timing of the pregnancy test is key, and if you don't know when you're usually having your period, then it's possible you are taking a pregnancy test too early, and maybe you are pregnant, and you mentioned that you just feel different. So the best thing for you to do would be to call your doctor. They can ask you more specific questions about your situation and decide if further investigation is warranted. In cases where it is warranted, a doctor may order a blood test, and that's very definitive. If you get a negative pregnancy blood test, you're not pregnant. But if you get a positive pregnancy blood test, then of course, congratulations is in order. Now, you also had a question about implantation spotting and whether or not the spotting you were having could be related to this. Vaginal bleeding is experienced by 20 to 40% of women during the first trimester, and there's 4 main explanations for it. The first is an ectopic pregnancy. The second is a miscarriage, and the third is a problem with pelvic organs. And if all of those things check out, the doctors looked into all of those different problems and everything's fine, then implantation bleeding is given as a diagnosis of exclusion. So implantation bleeding can't necessarily be diagnosed, it's just something that we figure is going on if you had spotting at just about the right time and everything else looks okay. So again, the best thing for you to do would be to talk with your doctor, and they can decide if anything else needs to be done for you. Especially if you're not pregnant this time around but desiring to have a baby, they can discuss options with you. There are things that can be done to help regulate your periods so that you know when you're ovulating, you know when you need to time intercourse with ovulation, and that will increase your chances of success. I hope the very best for you, and if you have any other questions in the future for me, feel free to ask them on our Facebook page at facebook.com/InterMountainMoms, and recommend us to your friends and family too.